The views and opinions expressed in the following program are those of the hosts, guest and producers. They do not necessarily reflect the policies and position of this channel. Viewer discretion is advised.
Good evening! We're back here at Ganap TV and we're excited kasi nandito kami sa Casa Medica, one of our major sponsor. Kaya salamat na pinaunlakan nila tayo dito para ma-interview natin. Kaya we're so excited and maybe we can talk also some of the doctors here later. So try natin kasi busy ito eh. This is a busy place and ayun. So importante meron tayong na-interview. Yan, nandito na tayo para interviewin natin ang ating guest. Ay walang iba, ang ating clinic manager na si Mrs. Angela Magdarel. Magandang hapon. Good afternoon. So, we're excited na makadaop. Palad ko kayo. Tagalog yun.
Kaya ko pa. Naiintindihan ko.
So, batiin po natin ang ating mga televiewers ng Ganap TV.
Oh, I see. Well, good afternoon. Welcome to Casa Medica. I hope itong hapon ito, meron kayong kapulutan ng kahit konting mga informasyon regarding health services from us.
Yes. Excited kami malaman kung ano ba ang kailan ito nag-umpisa ang Casa Medica at sino ang may-ari nito at kung ano po yung mga services nito.
Well, Casa Medica officially, nag-umpisa siya in October 1995 to be specific. And this was supposed to be a branch of Clinica Manila, a clinic back in sa Mega Mall. But then, nagkataon, hindi makonvince yung mga investors of that clinic to also be the same investors here. So, they have to get a different group of investors from the South, yung mga doctors from the South. Kaya, it was made as originally Mediserve South Mall that became Casa Medica in 2000. It was changed to Casa Medica in 2000.
So, ilang taon na po talaga ang Casa?
So, we just celebrated our 25th year last December.
Wow, congratulations.
Thank
Grabe,
you.
25 years, ang tagal na. So, ibig sabihin talagang maaasahan natin ang Casa Medica when in terms of health.
Yeah, hopefully and also praying na it will continue for the next 25 more years.
Wow. Kaya, Madam, so gusto lang namin malaman na yung mga, kasi ano mo, natatakot ang mga tao. Sa totoo lang, sa panahon ngayon, sa new normal, dahil sa pandemic, natatakot ang mga tao na magpunta sa mga hospital, sa mga clinics, because natakot sila makawa ng COVID, diba? Ng sakit. So, ano ba ang assurance ng Casa Medica na this place is safe for you to come, na talagang ready kayo i-serve sila?
Yeah. Well, before we resume after the lockdown, we are in coordination kasi with the DRRN or City Health Office of Las Piñas since we are under the City of Las Piñas. Yung mga protocol, like what are those that we can only accept in the clinic? Kasi meron tayo talaga ng mga hospitals designated to accept COVID cases. So we are not one of those. That's why may restrictions kami. So sa amin, doon pa lang sa door, before entering Casa Medica, meron na kami screening committee talaga, which we call the triage group namin. So sila, we have some checklist, which are those that we can accept and those that we will have to refer to a hospital. Kasi they are already considered yung mga PUIs, yung mga suspected talaga, COVID cases. So, they will be the one to manage, hindi na kami. But, just in case, there will be some cases na talagang, kumbaga parang high, ang talaga namin, factors na they may be COVID cases. We immediately coordinate with the RRN to have them pick up and transported doon sa hospital because they cannot join anymore yung ibang mga family members nila, but they will be given all the necessary advices. So dito, we're just happy that when we started in June, luckily, we are able to keep the facility free of any COVID cases, our employees, especially our doctors.
Wow.
And
So, nakakatiyak tayo na safe talaga ang Casa Medica. Kaya, huwag kayong matakot kasi importante na nag-check up tayo ng mga doctors. Kasi, pag hindi tayo nag-check up, baka lalong lumalala yung sakit natin, hindi natin alam. So, at least we have, di ba, like yung may mga sakit sa puso, may mga maintenance, na kailangan talaga may constant, hindi talaga yung mga online. What do you think? Do you agree with the online?
Well, we have doctors, especially the internists na, of course, these are the more related cases that they have received. Pero sa kanila, nag-aano muna sila, parang telemedicine, they interview them first over the phone or siguro yung whatever yung communication means, hindi sila yung face-to-face agad. So, those that they feel are safe for them to see here, yun ang gagawin. Otherwise,
So ibig sabihin, kailangan, pag pumunta ka rito, meron silang request from your doctors here, diba? Na, okay, you can come, like that?
No, kasi marami kami, actually, sa totoo lang, marami kami walk-in cases. But since yung doctors namin, when they started, they would like to go on an appointment basis. But we cannot do away, meron talagang darating dyan na magbabakasakaling makatingin.
Okay.
Pero, ang importante, kahit kasi appointment or walk-in, talagang dadaan din sa screening. So, kahit naka-appointment siya, pag hindi siya nakapasa sa screening, hindi rin namin sila papapasok.
Okay. So, pwede pala, I thought na bago sila pumunta rito, may request na from the doctor for them to see the doctor.
Yes.
So, ibig sabihin, this is the same procedure. It's a walk-in clinic that everyone can come basta as long as they go to the process ng triage. Diba?
Kasi even during siguro yung telemedicine, yung kanilang conversation over the phone, they may be assumed na, okay, they're safe. But doon sa actual screening,
Hindi sila
may makikita pa rin kami. So, hindi pa rin namin. So, we have already discussed this with our doctors na there is a possibility that even those that they have appointed already for that particular clinic time, hindi namin sila talaga papapasukin.
Yan. So, nakita natin, talagang safe na safe kasi talagang
may
mahigpit.
May
Kasi
area kami dyan.
saka pati kami, di ba? We go through the process. So, walang excuses. Ay, kami, dito kami sa Ganap TV. Wala po. Kaya, we have to go through the screening. So, safe talaga tayo. Ma'am, ano naman po yung mga services nyo dito? Do you have complete services like yung mga x-ray?
Kasi we are classified as ambulatory surgical clinic under the OH. So, we cater to consultation, general, and specialty consultation. So, we have about 88 specialists of different lines to cater to the patient. So,
like, anong mga specialty?
Well, starting off with allergology, dermatology, pediatrics, OB/GYN, ortho.
So, kompleto.
It's almost all,
Okay.
almost complete. And then, we cater also to diagnostic services like laboratory, X-ray, ultrasound, yung mga ECGs, treadmill, yung audio, and spiro, mga pulmonary and diagnostic services. We also do ancillary services like we have the rehab, yung physical therapy, and we also do minor surgery. So, yung mga minor surgical procedures under local anesthesia and as well as yung mga reconstructing under local anesthesia.
Wow! So, ibig sabihin, one-stop, clinic, di ba? So, hindi mo na kailangan pumunta pa sa isang hospital, sa isang clinic. Dito pa lang, pwede ka nang magpa-test ng lahat na kailangan mong test. So, syempre, usually, di ba, cashless na tayo.
Yeah.
Society, di ba? So, ano naman yung pwede nilang pwede nila ipangbayad? Ano mga cards?
Sa amin kasi,
Payment do you accept?
well, of course, aside from cash, we cannot help kasi meron pa rin patients who still are on cash basis. But we are accepting yung card, yung credit cards. And aside from that, meron kaming mga kliyente kasi yung mga HMOs na medyo wide.
Okay. So, like yung mga health, like Maxi Care,
Yes.
Card.
We are affiliated to all the major health HMOs like Maxi Care, Telecare, Medicard, Value Care. So, we're
Naman
affiliated.
pala, diba? So, ang saya.
Aside from that, meron din kami mga insurance companies na
Okay. That's great. Ayan, marami na tayong nakuhang mga information kay Ma'am Magdael. So,
Angie na lang siya.
Angela. Angie, yan. Parang barkada lang kami. Ayan, so marami na tayong nakuha information and I'm sure yung ating mga televiewers dito, pumunta na kayo sa Casa Medica. So, safe po yung place, safe for you to come here para magpa-check up na kayo kasi importante yan sa ating health. So, huwag na natin hintayin pa na lumala yung mga sakit natin. Instead na pumunta na kayo rito, huwag kayong matakot kasi for sure na safe yung place. Kaya, just Ma'am Angie, Angela, invitahin nyo na yung mga viewers natin, mga kaganap na pumunta na rito sa inyo. Ma'am, tanong ko lang kung meron ba ang Casa Medica ng mga membership, privilege, so ano po ito?
Actually, we thought of that kasi not everyone is qualified sa mga HMOs. So, may mga limitations or merong mga hesitations because of the budget. So, we came up with these cards. These are the cards that we offer from PEDJA to senior citizen. So, inclusive doon sa card na yun, there's annual check-up, depending on the age. So, may mga recommended packages kami. And discounted services naman on the consultation with our doctors as well as the diagnostic services.
So, paano po ba maka-avail ng membership card? Kasi di ba sa mga groceries, meron ng mga privilege card.
Yes.
So, nakakaroon ng points. Tapos yung points na yun, nagiging turned into cash that they can pay it as well. Parang, ganun po rin po yun.
Well, siguro that's where we are different from dito sa mga commodities. Ang sa amin kasi, talagang siguro with the diagnostic services, dyan na kami makakapagbigay ng discount. If you are a member, because this is just a one-year membership, which you have the option to renew or not.
So, how much naman po yung membership?
Ang membership is only 350.
300?
Yes. So, that also depends on the card that you are going to get. The card kasi ranges from different age groups. So, meron kaming from PEDJA, so may specific age group for that. And also, meron kami yung, we call it CASBA, which means these are yung mga schoolers. So, iba naman din ang recommended package namin for their age group.
So, tingnan nyo, 300 pesos against do sa mga discount na makukuha nyo every time you have a check-up. So, kailangan to sa ating mga pasyente, sa ating mga kaganap dyan, di ba? To avail the membership card.
Oo. Kasi we're promoting, syempre, health pa rin talaga sa amin.
At saka yung,
Preventive ang
mapagaan naman yung mga pasyente natin.
Parang sa amin kasi, since we are in a mall, rather than spending doon sa mga unnecessary, well, I guess this is a more valuable purchase that you can
And practical.
Yes, practical, especially at this time. Well, as of this time, we would like to invite you to come and have your checkups with some of our doctors here. We assure you, yung mga doktor namin magagaling kasi mga diplomate yan talaga, no? Well-screened at saka may mga earned titles sila. And so far, they have been able to manage well almost all the patients who have been seeing them. And you can be assured that you will be very safe in our facility because every day, aside from we screen all the incoming patients, talagang strict ang disinfection and control namin of any infection inside the clinic. So I hope you will be enticed to come for any health problems, that you feel you need some management with our doctors. Thank you. Sa ngayon, being in the health service, nandun pa rin yung pag-iingat. Kumbaga kami as frontliners, health workers, nag-iingat kami sa sarili namin para hindi natin ito, syempre, madala sa mga pamilya natin. So same goes with you, same also with our doctors. They are being cautious in every practice nila, in handling patients, and before they leave the clinic. So siguro parang this is now the new normal that we have to face and for the safety of everyone.
Tama nga naman, huwag natin pitpitin yung sakit sa ating tahanan, diba? So kailangan we should be conscious about our health, diba? So maraming salamat. Talagang we're so happy and honored na pinaunlakan niyo yung aming program dito sa inyong Casa Medica.
Thank you too. We're also honored.
Ayan, ngayon makakapanayam naman natin ang President ng Casa Medica. Walang iba, si Dr. De Leon. Ayan. Doc, tuwa naman ako kasi pinaunlakan. Alam namin busy kayo dahil may pasyente pa kayo ngayon. Talagang binigyan nyo kami ng oras. Kaya maraming salamat sa opportunity.
No problem.
Yeah. Kaya naman nakikita natin that really observe the protocol, naka-PPE suit. Talagang, why do you have to wear all those?
I wear this not only to protect myself, but also to protect other patients here.
So, paano nyo ba hinahandle yung mga patients nyo at this time?
We still observe physical distancing, but there's nothing much we can do. But if you have to examine the patient, we really have to examine the patient.
So you touch them?
Yeah, I touch them before and after. Of course, I use alcohol for my hand. And then, I protect it. I wear masks. And before they enter the room, before I start my office, the room is sanitized with ultraviolet rays, and then we have an exhaust fan over there, and we have HEPA filter. And ideally, we also have, sometimes we have room sanitizer.
So, paano naman ang pasok ng pasyente? Hindi naman sila natatakot sa inyo kasi mukha kayong astronaut. So, lalo, di ba?
Actually, they're not surprised.
Ganun naman lahat, di ba?
Yeah.
I think that's the new normal
Yeah,
now.
wherever they go, doctors wear PPE.
Yes. So, kasi before, ang alam ko na they don't really, ano yung meron kayong harang, tapos puro consultation lang. Pero ngayon talagang meron na talagang physical check-up.
Sometimes we cannot help, especially, like for example, if the patient comes into abdominal pain.
You have to touch them. Talaga kung saan talaga yung...
You really have to do a physical exam, or else you'll miss a lot. And I don't want to do that.
So nakita niyo naman si Doc, napaka meticuloso. Kasi mahirap naman talaga na puro kwento lang, di ba? So kailangan maramdaman at makita nila. Mahirap kasi pag-diagnose just to have...
Although with just a good history, you more or less know the diagnosis. But you have to, it has to be confirmed by a physical examination, a good physical examination.
So, dami natin natutunan dito ngayon talaga. So, Doc, ano naman po ang specialization mo?
I'm an internist.
So, ano po ba yung internist?
Internist, right after...
Siyempre, wala akong alam, di ba? Hindi mo na ako pwede.
Yeah, we're exposed to the different organs of the body. Just like general, what do you call this? A new graduate, but we have to specialize another 3 years for the other parts of the body. So we can handle more cases than the ordinary graduates of medicine.
So, Doc, how often are you in clinic?
Before the pandemic, and I'm in this office 3 times a week, in my other office twice a week. So Monday through Friday, I work.
You are. So, hindi naman kayo natatakot.
Well, initially, well, all of us were scared initially because we don't know what we are confronted with, especially the new virus, coronavirus, relatively new. Actually, it's a new virus. We don't know anything about coronaviruses.
So, Doc, salamat. Salamat dito sa information na binigay niyo sa amin. So, ano naman po ang assurance ng mga pasyente dito sa Casa Medica?
Well, rest assured that we're trying to protect first our patients and also our doctors and staff. So we do proper triaging. We do whatever the IATF or the DOH require us to do.
So, talagang safe ang ating mga pasyente.
So far, so good.
Yes.
So far,
So, wala naman tayong COVID.
No.
Ano dito, talagang safe. So, yun yung assurance natin na talagang ang Casa Medica ay safe place for the patients to come here para magpa-check up. So,
most of the patients I'm seeing now, they have been out for months. Then they found out that
pwede na pala.
it's safe to come to this office. So
Yes.
they're slowly coming out, especially if they need special
Check up.
Yes.
Yes. Importante, di ba? Sa isang almost 1 year na tayo, Doc, na hindi nakakalabas. At I'm sure
1 year.
1 year, yes. Almost na walang check-up. So, yung iba, nalala na pala yung sakit kasi wala nang check-up. So, ang Casa Medica would help you find your way na dito safe kayo, na huwag kayo matakot kasi they make sure na talagang they follow the protocol. So, Doc, mensahe na lang po natin sa ating mga kaganap. Ito po ay Ganap TV. So, kung ano po yung mensahe niyo sa ating mga televiewers about the situation, current situation, and how they're gonna, paano pa nila puprotektahin yung sarili nila from this virus.
Well,
Tingnan na lang po tayo.
with or without the vaccines, we still have to protect ourselves. We have to still follow the protocols. There are a lot of questions going around. After the vaccine, are we still going to wear PPE, mask, facial shield? The answer is yes, unless you get the herd immunity. Herd immunity means around 70% to 80% of the population have been vaccinated. And still, well, we try our best to protect our patients, especially, and as I said earlier, the staff and the doctors also. In fact, I disapproved of doing RT-PCR test here, because if we do the RT-PCR test here, oh my God, we'll be
The more yung virus.
we'll be having patients with symptoms, and that's what we want to avoid.
Okay. So,
Another thing, don't be scared of the vaccine. there's been a lot of
Rumors,
rumors
yeah.
going around. If you have allergy to this, allergy to that, you can attend the vaccine.
Especially daw kapag yung mga senior citizen.
Yes, yes. But,
But hindi pa kayanin ng mga senior citizen.
what I is saying is if you're allergic to vaccine, which is specifically the PEG or the polyethylene glycol that's included in the vaccine, if you're allergic to that you cannot have the vaccine. Otherwise, other allergies, food or other medications, no, you can receive the vaccine.
Okay. So, suggestion na talaga everyone should have.
Ideally, to get the what we call herd immunity.
Herd immunity. Yan naman eh. So, according to Dr. De Leon, na kailangan talaga natin na magpa-vaccine and huwag tayong matakot. So, yan ay para sa atin na rin safety, security, no? Doc. So, Doc, so ano pa po bang last message nyo na to?
Well,
Lalo na sa mga bata, na hindi nakakalabas, tapos sa mga matatanda na lumalabas, mga senior citizen na talagang matitigas ang ulo pa rin. So,
no, we have to follow the protocol. We have to follow the protocol. That's why the schools are still closed, cinemas are still closed, and we are going against something we don't know and we don't see. And
it's hard.
it's very hard. We really have to follow the proper protocol.
And Doc, paano yung sabi nila na they're gonna open na daw yung mga cinemas, and then yung mga events is almost like they're already 50% are already approved na pwede na silang bumano sa mga...
What I can say scares me.
Okay. Doktor na yan So, ibig ko sabihin,
Really
mismo
scares me.
silang mga doktor, natatakot din sila para sa atin. Yun po yun. So, kailangan din na sa ating mga sarili na dapat ingatan din natin. Kung ang mga doktor natatakot para sa atin, dapat matakot tayo sa sarili natin. Yun yung gusto sabihin sa atin ito. So, Doc, maraming salamat sa oras na ito na binigay niyo sa amin. And we're so happy and honored
You're welcome.
sa Ganap. So,